Hi, my name's Phil. I like talking about politics, and in this video, I like to discuss how, as we head to another autumn of potentially crushing COVID failures, Conservative MPs seem to be putting pressure on the media to keep people deliberately uninformed about the impact of our pandemic uselessness on the country. But first, if you'd like to be notified of daily news in politics, please subscribe to the channel and click the bell notification icon. So, there's a headline in the Mail on Sunday which says Tory MPs urge BBC to stop scaring viewers with daily COVID figures. There's a few things I could say there. But the first is this: the complaint isn't about how the COVID figures are being reported, but that they are being reported at all. Now, I'm fully seized of the notion that it is important to present any statistic responsibly. Our propaganda media often present statistics in highly misleading ways. So they will either present statistics and draw spurious conclusions, or they'll just present a statistic knowing that people will come to the wrong conclusion without any commentary around it. So when it comes to presenting the daily COVID figures, which, by the way, are not looking too rosy, hence Conservative MPs moaning about it, and we're about to see what happens, by the way, after kids return to schools and colleges and office workers are increasingly being brought back into the workplace, where they were managing just fine at home. We're not talking about the ones who couldn't cope. The article quoted Iain Duncan Smith particularly as saying, vaccines are really good at stopping hospitalisation and death, yet every night we report the infection rate. Why? Because it exists. If anything was killing the number of people each week that COVID is killing, it would be constant headline news and people would demand that the government do something about it. Right now, and it's still summer, got 800 people a week dying from it. Nearly 800 people a week. And the vaccine is really good at preventing hospitalisation and death. Were it not for the vaccine, we'd have way more, because we're in the vaccine is particularly effective in a population that applies mitigations to suppress the spread of the virus. But it is less effective in a population that throws caution to the wind and does nothing else. But when it comes to the reporting of the data, you can have a discussion. You might want to tell the BBC, for example, to report some sort of breakdown of those figures. Even then, you've got to be careful. You might say, for example, how many of the new cases, hospitalisations and deaths are from those who are double vaccinated, have had a single dose, or have had no doses at all. That won't tell the full picture, because the first people to be vaccinated without their booster yet will be now much less protected than those who've been more recently vaccinated. But it would add some further context. But that's not what these Tory MPs are calling for, because if they did, they might see the BBC reporting that the numbers of children being hospitalised and killed. The majority of those seriously ill and dying continues to be amongst the elderly, who, vaccine or not, are still more vulnerable to the virus. But there are children of all ages being hospitalised. There are teenagers dying. Of course, they don't want to make that point either. They don't want people seeing the number of vaccinated people dying, because then they might have to explain that, yes, the vaccine massively reduces the chance of death, but it doesn't eliminate it altogether. You need other things to do that, and we're not doing the other things. Similarly, they don't want people seeing children dying from COVID, because then they might ask why we're jamming them into unventilated rooms all day without even face masks being worn. If you look at this chart here, on the ONS, the government website, note the inconsistency reporting on infections. You may not see it too clearly, I'll point it out. You've got infections, hospitalisation, and deaths. So if you take the case of a 16-year-old, for example, let's say you've got a 16-year-old who becomes infected, then it gets worse, they become hospitalised, and then unfortunately they die. So for the infections, they are in the 12 to 24 age group boundary. But then for hospital admissions, it's not 12 to 24, they're in the 15 to 24 age category then. Then for deaths, they are in the 15 to 44 age group. How the hell does it even make sense to have a 15 to 44 age group? How are you supposed to make anything meaningful from that? If, for example, you want to consider the risks of sending kids to schools or colleges where face masks are not in use and ventilation is not in place, how are you supposed to tell anything from data that lumps mid to late teenagers in with those getting to middle age, around about my age? It's misleading to have inconsistent age group boundaries when you're talking about linked trends, like infection to hospitalisation to death anyway, because you might wish to analyse that. And even if you try and argue, but, in the younger age groups, there's very, very few deaths, so we'd have age, categories with like nothing in it. Okay, so you'd have nothing in it. You still need to do it, because it's especially misleading to come up with such a large age group for deaths. Because in that 15 to 44 year group, you literally have people at one end who have been double vaccinated for weeks like me. Double vaccinated since early summer. And then those at the other end of it who have only just been allowed to get their first dose of the vaccine. And because that's only just happened, the vast majority will not have even had their first one. And another thing I'd say to the Conservatives, if they don't like the way COVID figures are being reported, I would ask what their input is. I was just remembering last week that we've got a new health secretary. Matt Hancock, who had been health secretary for years, was replaced when Rupert Murdoch decided he'd had enough of him. We got Sajid Javid. The former Chancellor turned invisible backbencher to replace him. I keep forgetting, because he's gone from invisible backbencher to invisible minister. You never see him. The regular ministerial briefings are gone. I suspect this is deliberate to give the impression that the pandemic is over. The government are basically trying to pretend it's all over, as if somehow pretending it's over will make it over. I mean, this is Boris Johnson. Those close to him just say that this is what he's like. He's one of these people who thinks if you believe a thing enough, it just happens. We've removed almost all COVID measures now. Very little remains in place other than that which we voluntarily adopt. If they continued with the briefings, that would be odd, wouldn't it, for people? Because if we need the briefings, that means we're still in an emergency. If we're still in an emergency, why aren't the emergency measures still in place? Speaking of which, it'll be interesting in a couple of weeks in Parliament to see what the government do about their emergency powers. They're going to be up for a vote again for another 6-month extension. What excuse will the government give for renewing them? Because if they're not using them to enforce COVID measures, and if they're trying to pretend that we're past the worst now, surely they won't need emergency powers and can just let them lapse. You might also expect that if the government decide they'd like to keep them after all and put it to a vote in Parliament, that more Conservative MPs will potentially vote against letting them have them. Might be that even Labour decide to vote against them this time, I don't know. But that's a little aside for now. It'll come up later this month, along with a ramping up of Brexit problems, and coincide, you would think, with a renewed surge in infection caused by the return of schools in England and Wales. As I say, Scotland started back a week or two ago. But of course, the population of England is 11 times that of Scotland, and we have no mitigations in our schools. Both the rates of infection and death are going up even now. But I can imagine that there is more than a significant risk that it could look much worse come late September. But if the Conservatives have an issue with the way COVID figures are being reported, well, that's okay. Why not add your own voice to the conversation? Put on at least a weekly briefing to inform the public. Get our new health secretary to show his face, given that he is in charge of health policy in the middle of the worst health crisis that most of this country has known in its lifetime. Then the BBC can report on that. You'll also notice that this is a call to put pressure on the BBC to stop reporting the daily figures. It's not like they're the only media outlet to do this, so why target the BBC for this? Presumably because it is the only outlet which publishes the figures, which is also subject to intense political control from the Conservatives. But of the many things that occur to me to say to the idea of Conservative MPs who are upset at the COVID figures being reported, the main one is this. The media should report the news. That is their job. They don't do it very well in this country, but it is their job to do it. If you want the news to be better, make better news. The COVID figures are down in no small part to the performance of the government and their wider party. If you don't like the fact that the COVID figures don't look good, do something to make them look better. That's not, that something isn't just hide them and pretend they don't exist. But those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.